Do you experience a clicking sensation or maybe even some pain in your knee every time you kneel or you squat? What about if you're climbing stairs or if you're sitting in a chair and you're trying to get up? Does your knee click then? Well, if the answer to these questions is yes, you might be struggling with what we call patellofemoral pain syndrome. Essentially, it's an irritation at the back of your kneecap. The good news is you can do something about it. I'm going to demonstrate some exercises to you which are really simple and effective and you can do from the comfort of your own home, which will significantly reduce the clicking sensation in your knee. Okay, let's get started. So a quick 30-second lesson in anatomy. I won't bore you with it too much. This is a model of your right knee. And what you see here is you see the upper leg, the lower leg, and we have the kneecap in the front. Now this is the interesting bit. Look at the upper leg here. There's a groove here and the kneecap sits in this groove and it tracks it carefully and smoothly. Now what happens with the clicking knee is the kneecap doesn't track this groove anymore, and it's often to do because of muscle disbalances. So it sits next to the groove, not just right in the groove. So what we're going to do is give you strengthening exercises and stretching exercises that restores the muscle imbalance around your knee, so your kneecap can track this groove properly anymore and you won't be suffering from a clicking knee or a painful knee. So one of the most important muscles that you must exercise if you're dealing with a clicking knee or a painful knee is a muscle called the Vastus, Medialis, Oblique, and it sits in the inside here at the front of your knee. And I've drawn it actually on my knee. It's this little water droplet shaped muscle that sits here. And this muscle has an important role because what it does is it actually tracks the kneecap. It pulls the kneecap in the right direction. Now, there's a very specific way to exercise this muscle, and let me demonstrate it to you. What you need to do is get yourself a foam roller or a towel, so something to bend your knee, and then you need to put your knee on a resting position on this the foam roller. Now you straighten your knee, but the last 5 degrees, which is from here to here, you need to push your toes outwards. So you come up, push your toes outwards, hold this for about 1 to 2 seconds and come down again. And the same thing, so you straighten up, last 5 degrees, push your toes outwards, hold this for 1 or 2 seconds, come down again. And you need to do about 15 repetitions and you do about 3 sets. Now if you want to enhance this and make it a bit more difficult, you could use a Teraband. So I've just wrapped this Teraband here around the table. So pull the Teraband on top of your foot. Same thing now, so straighten your knee again and last 5 degrees, come up and down again. And you can obviously vary the pull of the Teraband to make it harder or easier. And the last thing you could add as well on top of this is one of these things. This is called an ankle weight. So you just push this over your foot on your ankles. Again, there you are. The same thing on your back, and again straighten your knee and last 5 degrees, really push your toes outwards. And the same thing here, 15 repetitions, 3 sets, once a day. So that's the first exercise that will help to reduce the clicking in your knee. Let's move on to exercise number 2. So this next exercise is a bit of a variation on the exercise we've done previously. What we've done is we've wrapped our Teraband around something sturdy, so you can use a table or whatever you want to use. I'm going to put my right leg, my affected leg, in here. Yeah, I'm going to place this a bit backwards. You can see the band is now behind my knee. You can have it a bit higher as well, behind the top of your leg. And all you do now is you extend the knee. So you go like that. Yeah, so you bend it and you extend it. So you push it back and straighten your knee as best as you can. And the best thing is to push it back, hold it again for 3-4 seconds and let go. And again, you hold it again, stretch it, hold it 3-4 seconds, let go. And last one. And the same thing, you do 10 to 15 repetitions and you do about 3 sets once a day. If you prefer, you can perform these same exercises seated. Let me do a quick demonstration for you. So sitting in the chair here, sitting upright, and all you do is again, you extend your leg and the last 5 degrees, you turn your toes outwards, you hold this for a few seconds and you drop it back down again. The same thing here, so straighten, hold it for a few seconds and repeat 10 to 15 times and do 3 sets. Or you can do, as demonstrated before, with the Teraband, you need to actually make quite a small loop here. So wrap it around one of your legs of your chair. Put your foot in. There you are. Sit upright, and the same thing. So we're extending and putting the foot out and coming back in again. So extending the leg, turn the toes out, hold for about 5 seconds, come back in again. Hold about 5 seconds, come back in again. And of course you can also use the ankle weight to wrap around your ankle and do the same thing. So this is the final strengthening exercise for your knee if you're struggling with a clicking knee. And after this, we're going to move to 3 stretching exercises for you. So the strengthening exercise, you need to find yourself a door or a wall or whatever you do. Lean against it. Place your feet about 15-20 centimeters away from the door. Make sure you've got about 30 centimeters space between your feet. And all you do now is you slide down. It's called the wall slide. So you slide down just as far as you feel comfortable. It might be that 90 degrees is too much for you and it really makes your knees ache and hurt. So you come back up again, come to 45 degrees. So you come all the way down. You hold this for about 5 seconds, yeah, and you come back up. Now come down again, hold this for about 5 seconds. Now the important thing with this exercise is this. Make sure that your knees stay straight over your feet. So make sure that your knees don't come in and do this, because that will hurt your kneecaps even more. Yeah, so you come down, knees are straight over my feet. I'm going to hold it here for 5 seconds and I come back up again. And all these exercises should be felt here where I've drawn this vastus medialis oblique on my leg. Okay, let's move on to some stretching for you. So we need to stretch 3 muscles around the knee. The first one is the quadriceps, which is the muscle in front of the thigh, top of the knee. The second one is the hamstrings, and the last one is the iliotibial band. It runs on the side of the knee. So we need to make sure we stretch them out so there's enough mobility in the knee and not too much pressure on the kneecap. So the first exercise, the stretch I'm going to show you, is for the quadriceps muscle, and it's an easy one. What you need to do is come and lay face down. Yeah, now I'm going to bend the affected knee. I'm going to hold on to my ankle, and all I'm going to do now is pull forward until I feel this stretch at the front of my thigh, in my thigh. Hold this for about 10 to 15 seconds and relax and repeat it about 5 times. Now you can accentuate this and make it a bit harder by pulling, and then what you need to do is raise your upper leg up as well, like that. And you hold this again for about 10 to 15 seconds and come down again and repeat about 5 times. So that's the stretch for the quadriceps, for the front of your leg. Now when you're dealing with a clicking and a painful knee, it's also important to stretch out the hamstrings, and the hamstrings sit at the back of your upper leg. I'm going to demonstrate 2 versions for you. I'm going to demonstrate it on my right leg. So what you need to do is lay on your back and then create a 90-degree angle in the right hip. Straighten your knee as much as you can, which might be up till here in my case. Interlock your fingers, place your fingers behind your knee, keep your leg as straight as you possibly can and pull your leg a little bit towards you. Hold this now for about 10 seconds and repeat 5 times. So that's one version what you can do. The second version you can do is you need to use a towel for this. Place a towel around your feet. Now straighten your leg from the start. Straighten your leg from the start. Lay on your back and use the towel to pull your leg as far up as you possibly can. Yeah, keep it straight. Hold this now again for 10 seconds and repeat about 5 times. So these 2 different exercises, they will focus on 2 different parts of your hamstring muscle. So the final muscle you need to stretch when you're struggling with a clicking knee is the ITB band, and I'll show you 2 variations. So the first one, again I'm going to do the right side, is sitting, I've got my left leg straight and my right leg bent. I'm going to place my right foot on the other side, my left knee on the outside here. I'm going to pull my knee now towards the left side. I'm going to turn my body towards the right, placing my right hand behind me, straighten up and pull that knee as far as I can. And now you should feel the stretch here on the outside of your hip. And this muscle runs from the hip to the outside of the knee. So it's important that we stretch this muscle. So this is the first stretch I'm demonstrating to you. Again, same thing. Hold this stretch for about 10 to 15 seconds and repeat about 5 times and do this daily. Now, the variation of this one is as follows. You're standing up. Now I'm placing my affected leg, so my right leg behind my left leg. Yeah, I'm going to push now my right hip towards the right, and we're going to accentuate this stretch with my right hand going on top of my head and on top of my right ear, and really pushing this to the side, keeping my body nice and straight and forward. So don't twist and turn. Hold to the side here. Hold this again for 10 to 15 seconds, and this should straighten out the whole of the ITB band on the side. So giving you more mobility in that knee and less of a clicking sensation. So hold this again for 10 to 15 seconds. Repeat about 5 times and do this daily. I hope you found some value in this video. If you did, please don't hesitate and comment, give me a thumbs up, subscribe to my channel. I love making these videos for you, and it works really motivating if I get a bit of feedback from you. So for me, for now, I say goodbye, take care of yourself, take care of someone else as well if you can, and bye for now. Bye-bye.